Applied Prevention Science International presents Prevention Portraits, a series of informal interviews with scientists, professionals, and other stakeholders who are contributing to prevention knowledge and practice around the world. We hope to bring you closer to their brilliant careers, experience, and professional paths in the prevention field. On behalf of APSI, thank you for joining us. Enjoy.
I'm Susan David of APSI, and I'll be joined by our president, Dr. Zilli Sloboda, in our discussion. Today, we are speaking with Dr. Chris Ringwalt, Senior Scientist at Pacific Institute for Research and Evaluation, and also a member of APSI's Senior Advisory Board. Hi, Chris. Thank you for agreeing to talk with us today about your career. To get started, would you please introduce yourself and tell people a bit about your about your current research work and focus?
Sure. Well, my name is Chris Ringwald. I have been in the prevention field since 1988. If you can do the math and figure out how many years that is, you are further along than I am. I started out working for the state of North Carolina, evaluating their suite of prevention programming in the state's schools, which at that time, as you can imagine, were in a very rudimentary condition. We didn't know much back then. We've learned a lot since then. I spent 10 more years at RTI International, Research Triangle International, and then I've spent another 20 years at Pacific Institute for Research and Evaluation with a joint appointment at the University of North Carolina Injury Prevention Research Center. All of that looking at a wide variety of aspects of prevention and occasionally leaking into epidemiology and occasionally into treatment as well. It's been quite a ride over the decades, and I look forward to sharing some of the highlights with you today.
Great. Zil?
Well, hi, Chris. It's really great to be with you today and to share what you've learned along the way. We've both been around for a while, and this is still remains for me the most exciting field and most challenging in so many ways. So I thought we thought what we would do is sort of talk about you mentioned how you started out in the field, and I think that was very interesting from looking at it from the statewide level. Then how it progressed over time. And actually, you're entering the field in 1988, I think is a great point in time, because I think that was a pivotal time from 1988 through 1990, actually, 1992. If you recall, we started the Society for Prevention Research in 1991 because we began to have programs that were showing effectiveness. But when you started out, you were in graduate school, what was your intention? What did you want to be when you grew up?
Well, I wanted to be a social worker.
Ah.
And for a while, I kind of sort of was. I have a master's degree in social work. I put it to use in a couple of fields. I taught social work for a year or two. I also served as a protective services caseworker, did some adoptions, did some foster care, sort of generic work in a county department. And towards the end of my second year on the job, I became increasingly disillusioned about my ability to do anything meaningful and lasting. So I threw it all in. And I thought, what am I going to do now? Got to do something with my life. So I went back to school and got a doctorate in public health education from the University of North Carolina, and really have never looked back. For a couple of years, I worked on a large prospective study of factors involved in child abuse and neglect. But eventually I thought, why am I staying in this content area We know so little, and I'm not sure we're ever going to know a whole lot more. And then a position became available with the State Department of Education of North Carolina, evaluating its drug-free schools programs. I thought, well, why not make the shift? See what happens. Totally opportunistic. A door opens, I go through it, there I am, there I've stayed. And as I said, it's been an extraordinary ride. But to say that I had a passion early on, that I was goal-driven, would be absolute nonsense. I came into the field because there it was.
I think that's going to be the story for many of our colleagues. That's sort of what happened with me also. I started out wanting to be in social work. And at some point I decided, I really want to make a difference and this isn't working for me. So I went into public health, into research. So yeah, I think we're going to see lots of parallels. You know, you've been around now in the field for a long time. What would you say was the most surprising outcome you encountered? I mean, both positive and negative. And I know something a little bit about your history, so.
You do, and I'm headed straight where you think I'm headed.
Okay.
The most surprising outcome I encountered was my study. It's where I peaked early on. It's been downhill ever since. My study of DARE, of course, where I failed to find any significant positive results. And I was pretty certain I would. Because when you deconstruct the DARE curriculum, it looks pretty much like most other curricula, pretty much.
Well, at that time.
At that time,
Yeah.
except that it's taught, of course, by police officers and not by teachers. And I thought, well, how much difference could that really make? And we still don't know how much difference that has made. And we probably, at this point, never will know. And it may no longer be an important research question. But that was my most surprising finding. And boy, did it get me in trouble.
Yeah. I can talk about what it was like when you wanted to report those findings from the National Institute on Drug Abuse, when I had to look at a press release about releasing these findings, which I'm not sure we actually came out.
I can report even now that the National Institute of Justice, who was our sponsor for one of the studies I conducted, said, we want you to suppress your results.
Yeah.
And that's just the tip of the iceberg of the story, but let's not go there.
That's what I was going to say. Because
lovely conversation this afternoon.
It would be, because I can talk about the other side of that, on the political side of that, going to the White House, but we won't do that today. You've done, I feel, I mean, you've done a lot of significant research. I mean, you're still continuing. I still see you're publishing in new areas, and it's very impressive. I think for me, for the field, I think one of the research efforts that you pursued that really, for me, was a turning point was when you were documenting how many middle schools and high schools were actually implementing, because at that time we didn't have evidence-based prevention interventions, but we had a series of lists of what were approved interventions. And I found that to be really, really important. I think that was a great contribution to make us really think about how we disseminate our research in a positive way so people can embrace it. And of course, that's almost the foundation for APSI to start with, is with that aha moment to train people in the prevention field. Do you want to talk a little bit about that research? Because I think it was very significant.
Well, I'm very grateful to NIDA for funding 2 rounds of grants. We were out in the field 3 times over the course of about an 8 to 10 year period, taking a look at the prevalence of school-based drug prevention curricula in the nation's schools. And then we were able to examine what proportion of those, in what proportion of those were schools actually administering evidence-based programs, and what factors were associated with the uptake of evidence-based programs, and what key ingredients or core components or what have you schools were actually implementing, regardless of whether they were part of an evidence-based program or not. I seem to remember we did all of that, and it was quite a lot of fun. We learned a lot along the way, until the reviewers the third time around said, "Oh, same old, same old. You want to do the same again? Ah, how tedious, how boring." And they said, "That's enough, goodbye." So I went on and did something else.
It's unfortunate because we still need that information. And that should be, you know, if we're building surveillance systems about substance use, one of the systems should be what's being taught in our schools, right?
I should think. And in fact, I think now we have very little idea if any of this is being taught or not and where. But maybe
That's right.
That's
Well,
right.
and of course now with COVID, the schools are being really challenged delivering interventions. And you know, I think that's another topic. Another person I think I would like to do a portrait on is Carl Hill and what he's experiencing with blueprints, because he's been surveying the developers of these interventions to determine how many of them are switching over to a virtual platform. So I think that's going to be very interesting.
it will be.
Right.
Susan,
Yeah.
you had a couple of questions you wanted to ask?
Yeah, Chris, low these many years, but in 2013, when Zilly called you and said, "How would you like to be part of this project, the Universal Prevention Curriculum Series?" And you said yes, and so did everybody else she called. But why did you say yes? What did you think about this curriculum idea that, you know, we're on the other side of it now. We've got it, it's here. But at that time, what were you thinking? What were your concepts of working on that project?
I think my thoughts, insofar as I can recapture them, were this is utterly loony and unrealistic. But hey, it's Zealy calling, so who am I to say no?
Oh, you mean it wasn't the great legacy you were going to leave?
Oh, no. No.
Well, it is now.
So what did you think about it?
I really don't remember. I probably thought in all seriousness, sounds like a lovely opportunity. It's going to be a huge challenge. Had no idea how much of a challenge it would turn out to be, how many corners would have to turn and ladders would have to climb to get from here to there. But even if I had known, I'd have thought, well, what else am I going to do with my life?
Well said. And you and I had a few adventures in South Africa when we tested the curriculum, the school-based curriculum. That I think that was really exciting to share.
It was exciting. I still remember how impressed I was and I remain with the cadre of trainers that we talked to. They were such lovely people.
Yes, it was an amazing experience for all of us.
And they're still training and doing the good work, which, you know, is just a great thrill from our point of view. Yeah, it's that was cool. Zil?
Yeah, no, I think just the last questions we wanted to ask were, you know, as you look back on your long history in the field, prevention science and practice, what do you see were the most important highlights in the field? And what do you see as future opportunities in the field for people who are new and they're looking around for a new field to enter? And there are quite a number of young people that are interested in prevention. What kinds of things would you say to them?
I got started because there were opportunities. My research career flourished for a time because there was financial support from NIDA. I don't know where NIDA's attention is today, but several years ago, I noticed the grants were being harder and harder to secure. I certainly had faced increasing challenges, and I finally said, I'm not going to go back into this arena again because I'm tired of being turned down. And in all seriousness, I think anybody coming into the field who wants to make a difference and do research, which is expensive, needs to have some sense of security and assurance that quality proposals will be met with funding. And I'm not sure that we in the prevention field have that anymore. In the last 5 or 10 years, I've scrounged around in different areas with a wide variety of clients, CDC, clients in the private sector, foundations, and so forth and so on. And I've cobbled together a perfectly satisfactory career, but it sure helped that I had a reputation to start with. Coming into this field totally new, you're going to be climbing a mountain, and there may not be a lot of resources there to support you as you climb. There will be colleagues, there will be mentors if you go out and look for them.
Yeah.
Here we are. But the money part of this is really, really essential. Because no matter the quality of the work that you do, if you can't get support to carry it out, then that's going to lead to frustration and burnout and disappointment. And I wish I had a more positive message to suggest, but there it is.
I think that from the research perspective, that is indeed the challenge. I think there are a lot of practitioners who are moving into the field who are excited because there is research and there's science base. But there's even there, the funding is of course sparse. On Thursday, we're going to be having a prevention talk around the culture of prevention. And I think that's what's missing. And but we haven't really defined that very well. We don't know what the components are. We don't know how to change things. And I certainly think that this whole public health crisis that we're in now has made people much more attuned to prevention. And perhaps I like to be upbeat. You know me, I'm always looking, I'm always optimistic. I'm hoping that people are ready now to hear that there are evidence-based things that they can do, evidence-based strategies, evidence-based interventions that we can put into place, and we just need the support for that. But there are a lot of, I noticed that when we go to the Society of Prevention Research, that there are fewer and fewer gray hairs. Of course, we might be dying them, but I think there are a lot more young. It's interesting to me, there seem to be more young women entering this field, both on the science side as well as the practice side, and they must see opportunities. And universities are starting to provide master's degrees, advanced degrees in prevention science. So I think that we're saying to the world, we are a field. I think, when we were in the past, I know you have the same experience, especially when you worked with DARE. The DARE officers at that time were considered kitty cops because they were working in the schools, and yet they were so dedicated to the kids because they didn't want to see those kids on the streets. They didn't want to get involved with that. So they were really inspired to do that. And I think that prevention has suffered because of, not because of DARE, but because of that attitude about working with children. And yet we know prevention, of course, has to be across the lifespan. It's not only children, it's adults, especially now. What are we going to face at the end of COVID if that's going to happen in the next year or so? Lots of problems will be the outcome of that. Susan, do you have any other questions?
No, I just want to thank Chris for being our excellent portrait today. And it's great seeing you again, and sharing this has been fun.
It has.
Do you have any final words, Chris?
Well, let's remember that prevention encompasses a wide variety of areas in addition to substance use and abuse.
Yes, absolutely.
I've written a chapter for an international toxicology journal on prevention of COVID. and
Yeah.
so forth and so on. So the principles that we're talking about, the methods that we learn and apply, these are fungible. They can be utilized in lots and lots of different areas of prevention.
Mm-hmm.
And there's no reason why those of us who get all the way through and learn the methods aren't fully equipped to be fairly nimble in moving from one content area to another.
Exactly.
So that's the encouraging part. Funding for I don't know what's going to happen to funding for substance abuse, but there are other risk behaviors and there are other issues and problems and challenges, all of which need the skills that our field has developed. Don't leave it all to the economists who they think they know everything.
I like to end on that note.
Well
Thanks
said.
again, Chris. It's
Bye, Chris.
always fun. Take care.
Take care.
Bye-bye.
Bye-bye.